Hi, I'm Frank Belmonte, Chief Medical Officer at Advocate Children's Hospital, and I'm here today with Michelle Tracy, Chief Nursing Officer. Today we want to talk about your safety, and specifically new steps that we are taking as an organization to protect our team members. As you all know, last fall, the American Academy of Pediatrics declared a national emergency in child and adolescent mental health. At Advocate Children's Hospital, we know this reality all too well. In 2021, nearly 20% of our admissions were for behavioral health problems, with diagnoses such as suicide, aggression, bipolar disorder, eating disorders, anxiety, depression, and more. While certainly not always the case, sometimes interactions with these patients, as well as other parents, caregivers, and visitors, can escalate and quickly become a situation where safety is a major concern for one or all parties in the room. In 2021, public safety was called to respond to behavioral health related events 383 times at our Oak Lawn campus and 165 times at our Park Ridge campus.
These interactions are extremely stressful for the team members in the room, and they put a lot of weight on public safety to de-escalate where likely they do not know much about the situation upon arrival. We knew we needed a new way to approach these situations safely and appropriately. As a result, we're launching the Pediatric Behavioral Health Response Team. The Pediatric Behavioral Health Response Team was created to mirror the already established Advocate Aurora Health System process for responding to patient behavior escalation within the adult hospitals. The goal of this new team is to decrease team member injuries, improve patient care, and decrease violent restraint utilization. Here to tell you more about the role is Megan Morgan and Christina Lupke, the leaders behind this critical effort.
Recently, all children's team members received the S-bar and a chart explaining the 5 roles within the Behavioral Health Response Team. We'd like to now walk you through those 5 roles, which include communicator, de-escalator, medical, safety, and support.
The communicator is providing key background and information about the patient to the response team as they arrive and during the situation. This is a role held by the primary nurse or charge nurse.
The de-escalator is a role held by someone trained in de-escalation interventions and serves as the one voice with the patient. This role, namely addressing the patient's psychological and physical needs. The individual in this spot varies depending on the time of day for the incident and is the most fluid.
The individual in the medical role will review charts for possible medical reasons for escalation and obtains and orders medication. This role is held by a physician, APC, or RN. The safety role is providing physical safety for all in the room and applies restraints if necessary, among other tasks. This will be public safety's continued contribution to this team, but now with more support in the room.
And finally, the support role is someone who will communicate with the family, assist with debrief, and provide patient services once the situation is de-escalated. This role can be held by several different individuals, including a nurse, child life specialist, certified teacher, and others.
It's our intention with this new team will now not only create a safer environment for our patient in these high-stakes situations, but also all team members in the room. These clear roles and tasks will help us all keep the situation as calm and smooth as possible through de-escalation. We sincerely appreciate everyone's teamwork as we roll out this new effort.
We cannot provide the best care for our patients without first taking care of ourselves. We want to thank all of you for your dedication to patient care over the especially trying times that we've had over the last 2 years. We recognize the stress you've been under.
It is our hope that the new Pediatric Behavioral Health Response Team will assist us in creating an even safer environment for our patients, their families, and our team members.